Good day everyone. It is nice to see you again. Welcome to our Any Learning, as our learning community. Lesson 4. Terrorism. The threat of terrorism is an ongoing concern. Terrorism involves overt actions such as the dispensing of nuclear, biologic, or chemical agents as weapons for the express purpose of causing harm. Methods of terrorism are as follows: firearms, explosive and incendiary devices, nuclear weapon, biological agents, and chemical agents. Nuclear terrorism. This is done by spreading of radioactive materials through ventilation system or explosion. Biological terrorism. Through dispersal of microbes or their toxins to produce illness, death, and terror. The paths of infection can be contaminated water, food, air, and packages. This is through microbes, such as bacteria, virus, and toxins. Chemical agents. Chemical agents kill or incapacitate people, destroy livestock or ravage crops. Some agents are odorless and tasteless. They can have an immediate or a delayed effect. Recognition and awareness. Being prepared for terrorism as a healthcare provider includes awareness of the potential for covert use of weapon of mass destructions, self-protection, and early detection, containment, or decontamination of substances and agents that may affect others by secondary exposure. The following are some general principles of awareness that should raise suspicion. 1. Beware of an unusual increase in the number of people seeking care for fever or respiratory or gastrointestinal complaints. 2. Take note of an unusual illness for the time of year. Clusters of patients from a single location should raise suspicion. Clusters can be from a specific geographical location, such as a city, or from a single sporting or entertainment event. 3. A large number of rapidly fatal cases should raise suspicion, especially when death occurs within 72 hours after hospital admission. And 4. Any increase in disease incidence in a normally healthy population should also raise suspicion. These cases should be reported to the State Health Department and to the CDC. The Centers for Disease Control and Prevention, CDC, is a federal agency that conducts and supports health promotion, prevention, and preparedness activities with the goal of improving overall public health. An extensive patient history is taken in an attempt to identify the agent involved. This history includes an occupational, work, and environmental assessment in addition to the regular admission history. Suspicions or findings are reported to the appropriate resources, Infection Control Department, Material Safety Data Sheets, or MSDS, in the facility, and to proper authorities in the community. Reporting also allows for sharing of information among facilities and jurisdictions, and can help determine the source of infections or exposure, and prevent further exposures and even deaths. Personal protective equipment. Chemical or biological agents and radiation are silent killers, and are generally colorless and odorless. The purpose of PPE is to shield individuals from the chemical, physical, and biological hazards that may exist when caring for contaminated patients. The following are the 4 categories: protective clothing and respiratory protection. 1. Level A. 2. Level B. 3. Level C. And 4. Level D. 1. Level A. Protection is worn when the highest level of respiratory, skin, eye, and mucous membrane protection is required. Briefly, this includes a self-contained breathing apparatus, SCBA, available in the pre-hospital arena. This also includes a fully encapsulating, vapor-tight, chemical-resistant suit with chemical-resistant gloves and boots. 2. Level B. Similar to Level A, and is selected when the situation requires the highest level of respiratory protection. but a lesser level of skin and eye protection. This level of protection includes the SCBA and a chemical resistant suit. 3. Level C. Protection requires the air purified respirator, APR, which uses filters or sorbent materials to remove harmful substances from the air. A chemical resistant coverall with splash hood, chemical resistant gloves, and boots are included in level C protection. And 4. Level D. Protection is basically the work uniform. Protective equipment must be donned before contact with a contaminated patient. Under no circumstances should responders wear any PPE without proper training, practice, and fit testing of respirator masks as necessary. Decontamination. Decontamination, the process of removing accumulated contaminants, is critical to the health and safety of healthcare providers by preventing secondary contamination. The decontamination plan should establish procedures and educate employees about decontamination procedures, identify the equipment needed and methods to be used, and establish methods for disposal of contaminated materials. The following are the 2 steps of decontamination. The first step is removal of the patient's clothing and jewelry, and then rinsing the patient with water. Depending on the type of exposure, this step alone can remove a large amount of the contamination and decrease secondary contamination. And the second step consists of a thorough soap and water wash and rinse. When patients arrive at the facility from a pre-hospital provider, it should not be assumed that they have been thoroughly decontaminated. Weapons of terror. Biologic agents most commonly used in terrorist attacks include anthrax, smallpox, botulism, plague, tularemia, and hemorrhagic fever. Table 3 shows the examples of biological agents that can be used as weapons. It shows the diseases and its causative agent. And Table 4 summarizes the examples of common chemical agents that can be used as weapons, with its corresponding action, signs and symptoms and treatment. Thank you for listening. Have a good day and be safe. Agyamanag.